Hello, it's Dr. Rhonda Johnson. Today is Tuesday, September 5th, 2023. And today I have a question for you because I would really like to know your opinion. So here's my question. Has our public health system failed us in containing COVID-19? Now, before you answer, I want to make sure we're all using the same working definitions. So I'd like to give a quick overview by what I mean by our public health system and containment of COVID-19. So according to the CDC, public health system is commonly defined as all public, private, and voluntary entities that contribute to the delivery of essential public health services within a jurisdiction. Okay? So we'll use that definition. So for example, just going to briefly go through a example of a public health system here in the United States is our local and state health departments and some federal agencies like the CDC, the U.S. Public Health Service, the Office of the Surgeon General, for example. An example of a private public health entity might be these very prominent schools of public health like the Johns Hopkins School of Public Health or the Harvard School of Public Health or the Yale School of Public Health. These institutions are part of university systems, but some of them have played a major role during the COVID-19 pandemic. Now, an example of a voluntary public health organization is a non-governmental agency, often called NGOs, that are citizens-founded and funded through contributions. Many of them tend to focus on a specific condition. Now, what does public health supposed to do? Fundamentally, they are what's called the 3 Ps of public health are prevention, promotion, and protection. So I know most people tend to think of public health as all epidemiology and infectious disease work, but it includes chronic disease surveillance, ensuring that the air, food that we eat, and our water is safe, and the huge environmental component. Also, public health has to do with data and biostatistical analysis, health policy and regulation, and social and behavioral sciences. So that's kind of what public health is and supposed to do. I've given you some examples. So then lastly, what about containment of COVID-19? What do I mean by that? Well, primary containment activities include personal and community mitigation strategies. That includes things like wearing a mask, physical distancing, promotion of hygienic measures such as hand washing and covering your coughs and sneezes, mass immunizations, quarantine, restriction of movement, clearance of certain entities. That's kind of what I mean by containment. There can be other coordinated operations with governments and public safety agencies. And I know you all want to say lockdown. Let me say lockdown, so I'll say it. So going back to my original question, has our public health system failed us in containing COVID-19? Now, you can answer it from your country perspective if you're outside of the United States, because it is a pandemic, which is global. All right, that's my message today. I can't wait to read some of your responses. And be well and be safe, folks.